Hello, welcome. My name is Dr. Bahati from the Department of Anatomy and Neurosciences in Kilimanjaro Christian Medical University College here in Tanzania. I will take you through in the discussion of the cardiovascular system, specifically the heart. And this is the systemic approach of anatomy teaching is based mainly for those who are taking BSc HLS or the Bachelor of Science in Health Laboratory. In other universities, in other colleges, they call it as the Bachelor of Medical Laboratory Sciences. And this is specifically for those who are taking Bachelor of Science in Nursing and Midwife, and those who are taking physiotherapy and occupational therapy. So we will be discussing the cardiovascular system. Specifically today, we are going to touch the part 2 of the cardiovascular system, which is the heart, whereby the part 1 is for blood and blood cells, and part 3 is for blood vessels. So please welcome for the discussion of today, the heart. All right, so welcome back again. As I said in my introductory remark, we will discuss today the cardiovascular system, but this is part 2 specifically for the heart. And these are my outlines. We are going to see the mediastinum, the pericardium, and then we are going to discuss the gross features, which are external and internal gross features of the heart. And again, we're going to see the coronary supply of the heart. And of course, at the end, you have to be able to mention some of the clinical applications related to the heart. So these are the learning outcomes, whereby at the end of this session, one or students must be able to describe the location of the heart. Where is the heart? And then you must be able to describe the external and internal features of the heart. And of course, you must be able to list and mention those blood vessels which supply the heart, and outline some of the clinical conditions associated with the heart. There are numerous of them, but we will touch some of them. All right, so the mediastinum. Now, speaking of the mediastinum, this is the region that extends from thoracic inlet up here and ends at the diaphragm down here. But as you know, the thoracic cavity is mainly covered by the lungs, and these lungs are on the left one and on the right side. But these two lungs, they do not meet in the midline, so they do not fuse in the midline, but instead they leave a region or a space between them. And this region is called the mediastinum. So we are going to see the borders of the mediastinum and the partitions or the divisions of the mediastinum. Now, the mediastinum, this region, is anteriorly bordered by the sternum, and posteriorly is by the vertebral column. And then superiorly we have the thoracic inlet, and inferiorly, just down there, is the end of the thoracic cavity, which is lined by the diaphragm. But you know, laterally, as we said, covered by is bordered by the lungs, which are covered by their pleura. So this is the membrane covering the lungs. So what are the structures which are found in the mediastinum? And these are some of them that you can see from this diagram, and whereby now you can see there is a heart and its covering. And then you can see some of the blood vessels and the nerves and the great vessels as well. But you also can see from here, you can see this is the trachea, and behind the trachea you're going to see there is the esophagus, and somewhere down here you can now see some of the other structures like blood vessels, again the descending aorta, and then you have the azygos, hemiazygos, and other vessels, and including the lymphatic vessels again. So this is the diagram to show you this region here is called the mediastinum. The mediastinum is further divided in 3 main divisions, and the division is made primarily at the manubrium sterni, or the angle of Lewis. So this is the angle of Lewis, whereby the manubrium sterni and the body of the sternum, they meet here, so they form an angle. So this is the transverse ridge like structure on your anterior chest, which you can palpate and feel this angle. So if you draw the imaginary line from the anterior to posterior, you meet the intervertebral disc of vertebral number 4 and number 5. So these are the thoracic vertebrae. And then by so doing, you will divide the mediastinum into superior and inferior mediastinum. However, the inferior mediastinum is further divided into anterior, middle, and posterior mediastinum. And then why is it divided in this? Because there are several structures which are found on different areas or regions in the mediastinum. So for the descriptive purposes, it has been divided into posterior, middle, and anterior. Strictly speaking, the anterior mediastinum is primarily occupied by few structures. We are going to see some of them. Of course, we've already seen some of them. And then for instance, the thymus, you can see the thymus. This is almost the only structure which is found there, but again, some of the smaller blood vessels and the ligaments and so forth, they occupy the anterior mediastinum. So our main topic of discussion today is in the middle mediastinum, which is occupied by the heart and its coverings, and of course some of the blood vessels, as you can see from here. And there is one very important nerve that you can see runs from the neck, from C3, C4, and C5. It goes all the way down to the diaphragm. You can see it goes up to here. It is called the phrenic nerve. I hope you are aware of it. That innervates the pericardium. This is the covering of the heart, and then the diaphragm as well. So we will see we will dwell mainly here in the mediastinum, and here it helps us in locating where is the heart. So the heart is almost at the center, projecting on the left side, and then it is covered by the membrane called the pericardium. So again, you can see some of the structures again which are found on the superior mediastinum. For instance, here you can see the superior mediastinum. You can see the trachea, the bifurcation of the trachea, and the trachea itself, the great vessels. For instance, this is called the left brachiocephalic vein, and this is the right brachiocephalic vein, the arch of the aorta, and the three great vessels emerging from the arch of the aorta. Now you can see the recurrent laryngeal nerve of the vagus nerve. It hooks around the arch of the aorta, and then it ascends upward there. So this again is the structure which is found on the superior mediastinum. But today our main focus is on the middle mediastinum, where we will be discussing this region here. All right, so where is the heart? You can visualize the heart as a cone lying on its side. It has the base and the apex. So the apex, or the pointed end of the heart, is formed by the tip of the left ventricle, and then the base of the heart, this is its posterior surface, and it is formed mainly by the atria, mostly the left atrium. All right, so the apex bit. The apex, as I described, this is the pointed end of the heart, which is mainly formed by the left ventricle, and it is found at the 5th intercostal space in the mid-clavicular line in adults. And again, it is approximately about 9 centimeters from the median plane. So the apex bit, this is the area where there is a maximum pulsation of the heart. That is the area when you put your finger, or the palm of your fingers, you can feel, or you can even see on the anterior chest wall. It is a place where you can see some of the pulsation or the vibration of the heart. So that is the apex bit. Now this is where we normally use in the auscultation. So what is auscultation? This is just the process of taking the heart sounds, or listening to the heart sounds by using the stethoscope. So the stethoscope, this is the device that is used primarily by the doctors and nurses when they wanted to hear the heart sounds. And at the apex is where we can hear valvular, or what we call the mitral valves closure, and that is where you can hear them well. So that is where now you can see the apex bit. It's around mid-clavicular line. So if you take the distance from the medial end of the clavicle to the lateral end of the clavicle, then you divide by 2, maybe possibly somewhere there, then you draw that imaginary line downward. So this is called the mid-clavicular line. And then at the 5th intercostal space, so I presume this is the angle of Lewis, that is the second just down to it. That's the second intercostal space. Then the third, the fourth, the fifth one. Then if you follow it, you will find this. When you follow it and then you meet the mid-clavicular line, that is normally where the apex beat is found. I mean, the apex of the heart is found, and that is where you can see the apex beat, which is the maximum position of the mitral valve closure. Alright, so that is the apex and the apex beat of the heart. So in auscultation, this is where you find the apex beat, the mitral valve closure. Here is where when you put your stethoscope there, you will find the tricuspid valve closure. So here is the heart sounds from the tricuspid valve. But then the aortic valve is here. But the maximum sound you can, when you put your stethoscope here at the second intercostal space, just lateral on the right side of the sternum, you will hear the aortic valve sound. Here again you will hear the pulmonary valve sound. So these are the areas where you can put your stethoscope in listening or in auscultation of the hearty sound. So these are the areas. But again, now sometimes in some of the conditions which affect the heart size, you can find this apex beat moving from the mid-clavicular line in the fifth intercostal space, and then you find it is just lateral to the intercostal space, a little bit downward there. Then you know that there is a shifting of the apex beat. But that in that case, now a doctor will know and start suspecting maybe somehow now the heart has enlarged. In what conditions? Like the hypertensive heart disease. Alright, so this stethoscope, the guy is now auscultating me. So if you see the doctor putting a stethoscope there, now he's listening at the aortic valve. And here, just the mitral valve, and here you are auscultating the pulmonary, and down here you are auscultating the tricuspid valve. Alright, so let's go to the covering of the heart. So now we are discussing the heart from external to internal. We just visualized the external surfaces of where we can find the heart and where we can hear its heart sounds. But now let's go and see what are the layers that cover the heart. So ladies and gentlemen, the heart is covered by the membrane or layers, and these layers are of two types. The outer one is called the fibrous pericardium. The inner one is called the serous pericardium. So the normal thickness of this membrane or the pericardium, it is about 1 to 2 millimeter. But again, the serous pericardium consists of two layers. These are the innermost is called the visceral serous pericardium, which is now, it forms the outer covering of the heart itself. And now sometimes it is regarded as the epicardium. And the outer one, just outer to the visceral pericardium, it is the parietal layer of the serous pericardium. So these two layers, they leave a space between, and this space is called the pericardial cavity. And within that pericardial cavity, a slightly thin film of fluid is normally present to reduce friction between these two layers. And now let's go and appreciate this. So when we say the fibrous pericardium, this is the fibrous pericardium. And just below the fibrous pericardium, you have the serous pericardium, which now it has two layers. In this case, this is the parietal serous pericardium, and the one that covers the heart is called the visceral pericardium. So this one is the visceral pericardium. This one is the heart muscle. And then you see between there is this another layer. So this is the layer of the serous pericardium, and between this viscera and the parietal pericardium, you have the pericardial cavity, within which you find the pericardial fluid. But again, in some of the conditions, you find these two layers that we've just discussed, they become infected and they get inflamed, and that condition is called the pericarditis. So there are a lot of clinical signs that are associated with that. But again, if these two layers, the parietal and the visceral pericardium, are inflamed, so they become swollen, and when they become swollen, they can rub against each other, and then they can produce added sound called the pericardial friction rub. So this, the pericarditis, makes a smooth opposing layers of the serous pericardium. They rub each other, and then so this can be picked during the auscultation, and then you can hear this added sound as the friction, pericardial friction rub. But again, in the chest X-ray, in a chronically inflamed and thickened pericardium, this pericardium can may calcify and leading to the serious hampening the cardiac efficiency. Alright, so sometimes fluid can accumulate in the pericardial cavity, and this is clinical condition is called the pericardial effusion, and sometimes blood can accumulate there, and we call it hemopericardium. So as a result of this accumulation of the fluid, it can lead to the compromisation of the cardiac activities, and hence the heart may be unable to expand or contract freely, and this can be even more serious in the patients who have what we call the congestive cardiac failure. And then this, if the fluid is too excessive, then it can compromise the ability of the heart to expand and relax. And in that condition, in such condition, it can even lead to it can produce a pressure effect whereby the heart now will be more compressed by the fluid, and then these great vessels, for instance the superior vena cava and inferior vena cava, can hardly drain into the heart. And then you can find people or patient having this kind of clinical condition whereby there is a massive accumulation of fluid in the pericardial cavity. You can lead to the condition called the cardiac tamponade. And this, in this regard, the cardiac tamponade, it's a medical emergency, of course, and because it compromises the venous return, so the fluid, the blood cannot enter the heart. And then if the condition left untreated or not dealt with promptly, then the complications of this problem may lead to edema, shock, and even death. So what do we do normally? We do what we call the pericardial synthesis. So the pericardial synthesis, this is a surgical kind of a procedure whereby the needle is inserted at the 5th intercostal space, just left to the sternum, or at the 6th intercostal space near to the sternum, and then you can puncture the pericardial cavity, and then the fluid can just get out. So this approach to pericardial sac, and it is possible because the cardiac notch of the lung, it leaves a space for us to put a needle, and then in the left pleural sac leaves the part of the pericardial sac exposed. So this is called the bare area of the pericardium. So this is the diagram to show you where you can put your needle. So this is the 5th intercostal space. So here you can see the cardiac notch, and then you can even insert your needle there. But sometimes some people or some doctors, they prefer to just insert the needle below the what we call this the costal margin, just lateral to the xiphoid process, and then in that approach again you can reach the pericardial cavity and then drain the fluid. But again, now this is very important for your understanding. The pericardium is innervated and it is supplied by the nerves and the blood vessels. So the arterial blood supply to the pericardium, it is called the pericardiocophrenic artery. So this is the artery that is the branch of the internal thoracic artery from the left and right, and then from the internal thoracic artery you see these two blood vessels from the left and right supplying the heart. So this is the diagram to show you internal thoracic artery coming from the left and right subclavian arteries, and then so it gives this branch is called the pericardiocophrenic artery that supplies the pericardium and on both sides. And again, the veins sometimes they drain from the pericardium direct to the brachiocephalic vessels. So these are the left and right brachiocephalic vein. Now you can see the pericardiocophrenic vein draining in there. But sometimes some of the people, they have this pericardiocophrenic vein draining into the internal thoracic
vein. Alright, so the pericardium is supplied or innervated by the nerve, and this nerve is called the phrenic nerve. As I described previously, I said this is from the C3 all the way to C5. And then this is very important. Why? Because if you have the problem in the pericardium, you can feel the pain on your neck. So the sympathetic, we have the sympathetic nerve again that comes from the sympathetic trunk supplying the pericardium. Alright, so having seen the neurovascular supply of the pericardium, we have just seen the phrenic nerve and then sympathetic trunk. Please don't forget the pericardiophrenic artery and vein as they supply the pericardium. The next session we are going to see and discuss the heart itself, from the epicardium to the myocardium and the internal features of the heart. Thank you.